Thanks for sticking with us on this Sunday morning. We are now learning that pneumonia was the cause of death for actress Diane Keaton, who passed away last Saturday at the age of 79. Following the news, searches for the virus skyrocketed on Google as people try to understand what led to the beloved actress's death. Here to discuss is family physician at Salem Family Care, Dr. Mike Sevilla. Dr. Sevilla, welcome to the show.
Great to be here.
Let's start with the basics. What's pneumonia and how could it be fatal?
So pneumonia is an infection of the lungs, and I've been getting a lot of questions on, who should be vaccinated for this. And, there are higher risk groups, patients, people over 65, smokers, people who have chronic medical problems like diabetes and heart disease and lung problems. Why it's fatal is because if left untreated, pneumonia can cause a serious infection called sepsis, which can lead to organ damage, organ failure, and ultimately death.
Thank you for that, Doc. Let's talk about protecting ourselves. There is a vaccine. Which groups of people should be receiving them? Is it the ones you just mentioned, the ones on our screen?
Yeah, those are the people on that are at higher risk. People over 65 who smoke, who have chronic medical problems, and people who have weakened immune systems. People with cancer and those type of patients.
One sign of pneumonia is a fever, but it could also signal other things. Some could be serious, some could be minor. What happens to the body when you have a fever, and when should you go to the doctor? Is there a certain temperature where you think, okay, it's time to go to the doctor?
Yeah, so when people have a fever, it is a response to either infection or inflammation or even some chronic medical problems. When I advise people to go to the doctor, or, when your temperature is 103, when it is a high temperature for more than 3 days, when you've been trying to use fever medicines like Tylenol and ibuprofen, or if you have changes like confusion or chest pain or shortness of breath, those are when you should go and see the doctor.
As a family physician, is medicine always the answer when you have a fever, or sometimes should you just let nature run its course?
Yeah, I get that question a lot, and it really depends on, how you're feeling, what the temperature is. But, sometimes I have people write it out, or especially if they have a lot of chronic and medical problems, to go ahead and take those fever medications to bring your numbers down.
It is flu season, so thank you for answering those questions. I want to ask you about something else. The FDA has cleared a new blood test to rule out the possibility of Alzheimer's disease. This seems like a huge development. How will the test be used by primary care doctors, and how soon could this be used?
Yeah, that's a great question. This test is another tool in our toolkit as primary care physicians. I advise patients there's not one test, that could be used to diagnose Alzheimer's disease. The best thing is to check in with your family doctor, have your physical exam, and see if this test is something that is appropriate for you.
I am curious, how will these types of early detection tests, and we're seeing more and more of them, impact the way primary care doctors like yourself approach patients with, let's say, memory concerns?
Yeah, it's just, we didn't have access to testing like this in the past, so I'm very excited about it. But it's not an end-all, be-all. It's one of the tools in our toolkit, in addition to a physical exam and some other testing, which we can see if the patient is at risk for Alzheimer's disease.
Okay, so definitely the early stages there. Also, here in New York State, health officials have confirmed the first transmission of a virus. It's called the chikungunya virus. It is a mosquito-borne illness. This is the first case in the U.S. since 2019. What should people know? What symptoms should we be looking out for, Doc?
Yeah, so this is a mosquito-borne illness, and the symptoms are, things like muscle aches and body aches, fatigue, rash, fever. You can treat these early symptoms just with treating the fever, rest, and hydration, and those are some early things that you can do.
How can we protect ourselves? What are some mitigation strategies?
Especially for anything mosquito related, you can use your mosquito repellents, and mosquitoes like, when there's standing water, so avoid standing water, wear those long sleeve shirts and pants. Those are ways to really kind of prevent and decrease your chance of mosquito bites.
A lot of important health headlines. Thank you for answering a lot of our questions, Dr. Mike Sevilla. We appreciate it.